Hi, my name is Mike Krajewski. I'm here at Target Pharmacy in Buffalo, New York with Mr. Stefan Brand, supervising pharmacist. I'm just going to ask a couple questions about the pharmacy. Mr. Brand, what do you see your role as the medication expert or pharmacist in this community setting?
I think the role of a pharmacist in a community setting, at least my role, the way I view it, is to really be an educator for the patient and provide them with the knowledge that they need to take their medicines properly, not just on time, but in the proper combinations with other medicines to be sure that they're not taking things that are over the counter that might interact with them, or other medications, and to be their advocate with themselves and their prescribers if they have multiple prescribers. So sort of take in the big picture and make sure that everything is being used properly, and make sure that the patients understand that, not just when to take the medicine, but how and why they're taking the medication, so they have a better understanding and are more compliant with their medication.
Okay, that's very good. Do you think of any instances recently where your intervention helped the patient and maybe prevented a further medical problem or even hospitalization?
As a community pharmacist, we run into questions very frequently. I can think of a time recently where I had a recent guest who had a heart attack and is now on new sets of medications, and one of the medications was a medicine that slows his heart rate a little bit, and he's a very active person. And I explained to him, that he has to be more careful exercising, because his heart rate is not going to go up very quickly to get more blood, more oxygen to his muscles as quickly as it would have before, because his medicine is keeping his heart rate down, and it may have prevented him from having a fainting spell, or having trouble exercising where he could have gotten hurt or something like that. So now we understood the reason for this side effect of his medication and how to avoid it. But we run into multiple issues on a nearly daily basis, especially with diabetics. There's a lot of times that a new diabetic may not understand necessarily exactly how their medications work, and to help them to just recognize the signs and symptoms of like hypoglycemia, which can be very serious if they don't know what to do. If they do know what to do, in many cases just involves having some glucose tablets handy, or some juice or something like that. But if they don't know, they could end up in a hypoglycemic shock and be rushed. They need to go to the emergency room of the hospital. So there's lots of different details that are important for people to know that they may not always get, that the pharmacists help them with.
All right, well, thank you very much for your time and sharing your insights and sharing the vital role that pharmacists play.